Well, hello, Judy. It's so good to have you with us again today. How have you been doing?
I've been doing very well, thank you.
So we're all pretty concerned over here because we heard we've had a number of new active cases this week. We even had a death of one of our more senior members in the Hispanic community, and just really grieving that. And I think a lot of people are kind of wondering what's going on. What is the recommendations of the health department for this weekend? How bad is it? How bad isn't it? People are kind of wondering.
I think it's important for people to understand that it is getting worse. There are more cases. And so it is really important now that people do stay home. If they've been asked to quarantine, that means they should stay in their home and not go out into public places, grocery stores, events, church.
So I know this weekend there is a big public event, Dorchester Days, and there's been some other events planned. What is your recommendation in regards to that? It almost looks like the county is allowing us to get together because this event is happening.
Well, what I want people to know is that the county can't force events like that not to happen. It is allowable, it is legal for them to hold those events. However, the county health department does not recommend that those events happen. Those events where we bring a lot of people together put people at risk for being exposed to COVID disease.
So what I'm hearing you say, it's your recommendation not to attend events like this?
It would be better if people did not attend. Anytime that you're in contact with a lot of people and you're in close contact, and you can't social distance, it's hard to wear a mask, it's hard to keep your hands clean, you're putting yourself at risk of getting disease.
Um, I think a few people are wondering about people who are in quarantine versus people who have COVID. Could you talk a little bit more about exactly how quarantine works and how maybe as me as a friend or family member of someone quarantined, how I should be relating with them?
Yes. So if a person is sick with COVID, they are asked to isolate. That means they need to stay home, not have any visitors. They even need to stay away from the people that they live with so that they can keep that disease to themselves and not share it. For people that have been quarantined, that means that they've been exposed to somebody who's already sick, and we still want them to stay home. We don't want them to go places where they could potentially give it or get it to other people. And we want them to make sure that it's not spread any further. What we're waiting for is the symptoms to appear. If symptoms don't appear, it's good. But if symptoms appear, we know you're sick and you need to stay home.
Okay. Thank you for that. I just know a lot of us in town. I mean, the timing of this, I don't think it can ever be good, but it's like we were under a state quarantine for 2 months and then we get it. And I think just a lot of people just emotionally, it's been very trying. I just wondered if maybe you could give us a bit of a picture, long range thinking of how you see this in our town for the summer coming forward.
I think for the town, I think we will see more spread within the town over the summer. Nobody is immune to this disease, and so it's really important that we do follow the things that we started to do this spring. When we were staying apart from one another, we weren't spreading the disease. Now we're getting out and socializing a little bit more, and we're seeing the disease spread more. I think we have to go back to staying apart a little bit more to slow down the spread so that, as a community, we can handle this. It's going to take some time, but we will get through this.
I just know it's only human nature as the weather gets nice, but what about, a couple of families who are related, maybe living in different homes? Is it advisable for them to have like a cookout, out in the garage or having the kids playing basketball together? Is this a good idea for families to be doing in the near term?
I recommend that families limit their contact to the same contacts. So for me, it would be me and my children and their families coming over, but I would limit it to that. I wouldn't have then the next door neighbors and all of their family come to my house as well. So we need to keep a smaller number of contacts that we are close to and not have more than one family joining our family.
Okay. So group size is important here, and then consistent contact, that you're not contacting tons of different people, but same people.
It's important to limit the number of people overall that you're in contact with. So staying within your close family unit is the best way to go about this.
Okay. For people who have been a close contact of someone who has it, maybe they're under quarantine themselves, what are some things that they can do at home just to maybe stay as healthy as possible? Like if you got a cold, you take vitamin D and stuff like that. Is there some general recommendations for people who might think they could have been exposed that they can do just to help with the possible symptoms or something like that?
There's really not anything that we know of that can help prevent you from getting it, other than washing your hands, keeping if you are not touching your face, using Kleenex and then throwing that Kleenex away, not having anyone else touch those things, that can help from germs spreading.
Mhm. Very good. And then just as far as I think a lot of people are worried that if they get this virus, what it could mean for their livelihood, their job, and everything. Has the county been supporting those people who are in quarantine?
Are you asking financially
Sure,
or?
financially or just checking in on people. Is there been a response that way?
So at the county public health department will call and check in on people to help monitor symptoms. We want to make sure that people, when they're sick at home, if they're getting very sick, we want to encourage them to then seek medical care. Sometimes people need to go to the hospital and be hospitalized. So we do call and check on them. We also work with community agencies to help make sure that they have the resources that they need, diapers for kids and food for the family, and rent if they can't make rent. So we try to connect them to other services where they might be able to get those things that they need.
And I know, Judy, we've been had a meeting today about doing something more in our community and getting together. And so we look forward to talking more about that when we got everything all set up. But it's been a joy working together with everybody. Is there anything else you want to share with us before the weekend, Judy?
No, I just want to encourage people to protect themselves, protect their family. We'll get through this together.
I really appreciate you taking this time, and I know you've been doing other videos, and that's just absolutely wonderful. And we look forward to being in touch and continuing to work together.
Thank you.
Thank you.